P. Now coming to seminoma proper, it is the most common type of germ cell tumor. It makes up 50% of germ cell tumors. Its peak incidence is in the third decade. It is similar to dysgerminoma of ovary. तो ये आपको वाइवा में पूछा जाता है कि सेमिनोमा का फीमेल काउंटरपार्ट या ओवेरियन काउंटरपार्ट क्या है, सो दैट इज डिसजर्मिनोमा. या उल्टा पूछा जाता है कि डिसजर्मिनोमा का मेल काउंटरपार्ट क्या है, दैट इज सेमिनोमा. It expresses OCT3 and nano-G, so these are used as IHC markers for diagnosis of these tumors. Morphology of a typical or classical seminoma, it is a bulky tumor. So they are bulky masses, maybe 10 times the size of a normal testis. Cut section is usually grey-white and it has a lobulated cut surface. It is devoid of hemorrhage or necrosis. Tunica albuginea normally or usually is not penetrated, but it may extend into the epididymis, spermatic cord or the scrotal sac. Now this is how it looks like. This is a very small seminoma. You can see this is located in a very small part of the testis. This is the normal testis. So it measures 0.9 centimeter confined to the testis and did not have any microscopic lymphovascular invasion. Now this is again a picture of seminoma. You can see this is the entire tumor. It is bulky, grey-white, and this is the compressed testis on the other side. So microscopically it consists of sheets of uniform cells. There are sheets of uniform cells which are divided into demarcated lobules. Very important. These are the key points you must remember for your viva. So there are sheets of uniform cells. There are divided poorly demarcated lobules, and the lobules, the fibrous septa which are lining the lobules, they have lymphocytic infiltrate. So there are lobules of clear cells or uniform sheets of cells which are confined into lobules. Lobules, fibrous septa have lymphocytic infiltrates. They may also have granuloma. Okay. Now a classical seminoma cell, if you are asked to describe, it is a large polyhedral cell with a distinct cell membrane. It has a clear or watery appearing cytoplasm. It has a large central nucleus and it has one or two prominent nucleoli. So this is how it looks like. Now these are the seminoma cells. If you look carefully, these are clear cells. Individual cell को अगर आप देखेंगे ध्यान से, so they are clear cell. Now these are the fibrous septa. And these are the small lymphocytes. If you can appreciate, these are the blue dots. These are the lymphocytes. So this is a lobule of seminoma cells. These are the fibrous septa, and the fibrous septa have lymphocytic infiltration and also sometimes granuloma formation. Other microscopic features are that it has variable number of mitoses, that is abnormal mitotic figures. There are tumor giant cells. The anaplastic features include tumor giant cells, greater mitotic activity. IHC, it stains positive for KIT, OCT4 and PLAB. It may be keratin positive. More than 15% they have syncytiotrophoblasts. In such patients, the serum HCG gonadotrophin levels are elevated. It may have an association with a well-defined or an ill-defined granulomatous reaction. In contrast to the well-formed discrete granulomas that we see in tuberculosis, the granulomas of seminoma, they are ill-defined. Now coming to a variant of a seminoma which is called a spermatocytic seminoma. It is a rare variant or a rare type of seminomatous tumor. It is slow growing. It is seen in elderly males more than 65 years of age. It is usually unilateral and it has a good prognosis. Morphology of spermatocytic seminoma, it is soft, pale, it has a grey cut surface. It sometimes reveals mucoid cyst. There are three cell populations. First is a medium-sized cells which has a round nucleus and eosinophilic cytoplasm. Second is smaller cells with narrow rim of eosinophilic cytoplasm. And third are scattered giant cells with single or multiple nucleoli. So in contrast to a typical or classical seminoma, the spermatocytic seminoma, it lacks lymphocytes. So there are no granulomas, there are no syncytial trophoblasts. It might have an extra testicular site of origin. There might be admixture with other germ cell tumors, and it is associated with intratubular germ cell neoplasia or cryptorchidism. So this is how it looks like. These are the spermatocytic seminomatous cells which exhibit pleomorphism. There is variation in shape and size of the tumors. A differential diagnosis of spermatocytic seminoma is classical seminoma. IHC is useful for distinction from classical seminoma, and radical orchiectomy is curative. Thank you so much.